Medicare is not free and Medicare Advantage is not free. So let's talk about the cost of Medicare Advantage. First, when you are in a Medicare Advantage plan, which is Medicare Part C, you still have to enroll in Medicare Part A and B, just like those people who remained in original Medicare. So Medicare Part A, it's typically a $0 monthly premium. That's the FICA tax you were paying all those years to cover that premium. Medicare Part B is typically $174.70. That's all your outpatient doctor services, whereas A is your hospital coverage. Now, you see I wrote the letters IRMAA. So some people, if you're a higher income earner and you earn over a certain threshold, you're going to pay more than the standard $174.70. So as I said, everybody on Medicare has A and B. And then some people go to original Medicare, they get a supplement in a Part D plan. Here we're discussing the people that don't do that. They go to Medicare Part C or Medicare Advantage. So let's talk about Medicare Advantage, Medicare Part C. It's a totally different system. So as I mentioned, if you're an Advantage plan, you still have to enroll in A and you have to enroll in B. But now, instead of sticking with original Medicare with the Centers for Medicare and Medicaid Services and getting a supplement and a Part D plan, you instead are going to enroll in a Medicare Part C plan with a carrier. So it's private managed care. In that plan, that company is going to manage your A benefits, your B benefits, and most of them have Part D, the prescription drug coverage, built into the plan. There are some plans without it, but most people, unless they're in the VA or have some sort of other coverage for prescriptions, are going to want to choose a plan with D built in. So let's talk about how you pay for Medicare Advantage. Typically, you're going to see a $0 monthly premium, which entices a lot of people in, but you do have to understand the structure. You are cost sharing with almost all of the different medical services you receive. So let's say you go to the doctor, maybe you pay a copay. And what the plan does is it defines a max out of pocket that you could spend, or a MOOP. And each plan, each zip code, each state, there's different MOOPs. So when you're looking at a Medicare Advantage plan, you want to understand what is the max that you can spend. And typically, a PPO is going to have a higher max out of pocket than an HMO. So what's going to happen is, for example, let's say a max out of pocket in a plan is $5,000 and you have a 3-night hospital stay, and they define each day the copay for a hospital stay as $330. Then you know you're spending $990, and that's subtracted from the max out of pocket that you could spend for that year. As I mentioned, most of these plans have prescription drug coverage or Medicare Part D built into it. Any copays or coinsurance you pay for your medications does not count towards the MOOP. That is in addition to the MOOP. Most plans do not charge an additional premium for drug coverage. There's some that may have a small premium added on, but either way, if you have an income-related monthly adjusted amount because you are a higher income earner, that will apply for this plan as well. It applies to B and D, as I mentioned. So when you look at this, you can understand what I mean by pay as you go, because you are paying cost sharing, but only up to a certain amount out of pocket. And even if it's a $10,000 service, maybe you're paying $350. But the point being is there's a max that you can spend. One last thing before I move out of the way so you can see the chart. Don't mix up a deductible with a MOOP or a max out of pocket. Sometimes people see the MOOP, they say, oh, it's $5,000, and they think they have to spend $5,000 first before the plan helps them. That is not how it works. As I explained, it's just the max that you can spend. All right, here's the chart.